To use an incentive spirometer with your patient, the first thing you need to do is verify the doctor's orders to make sure that it is in fact ordered for your patient. And then you need to set a goal. The goal for your patient is going to be based on their age, their height, and their gender. And then there's a couple of important things to remember with IS. One of those things is that IS is used as lung expansion therapy in order to help prevent or treat atelectasis in patients. So, a lot of the patients that do IS probably are post-op, and so in order to help keep their pain under control, we can either request from the nursing department that the patient receive pain meds before treatment, or we can teach our patient a splinting method in which they hold the pillow against the incision area during treatment to help prevent pain. So, this is an incentive spirometer. You set your goal based on, like I said earlier, the height, the age, and the gender of your patient. So for a male who's 80 years old and is 74 inches tall, 2850 would be the appropriate goal. You're going to instruct your patient to exhale fully, at which time they're going to wrap their mouth around the mouthpiece and they're going to take a slow, deep inhalation, as deep as they can for as long as they can. At which point that they can't inhale any further, they're going to hold that breath for 3 to 5 seconds, maybe a little bit longer, as long as they can tolerate, because by holding the breath, that's going to help pop open the alveoli, and that's what's going to prevent the atelectasis. And then they're going to repeat this about 5 to 10 times per hour. So when they inhale through the mouthpiece, this white float down at the bottom is going to rise as they inhale, and the float on the side here is going to rise. We want this to say better or best, and we're going to try to get that patient as close to their goal as possible. We want to make sure that we're coaching them correctly and they understand how important it is to hold the breath. When they are finished with their treatment, then we're going to have them take a deep breath in and cough, and then we're going to do a final assessment. So we're going to assess their breath sounds again. We're going to reassess their vitals, and we want to see if this treatment has actually done that patient any good. And then we're going to encourage the patient to continue and use the IS throughout the day, 10 times per hour. And eventually it's something that they can take home when maybe they're released from the hospital, and they'll be able to continue to do this to help increase their volumes.